Welcome to the deep dive. Ever wondered about that soft swelling you sometimes see on a newborn's head right after birth?
Hmm.
Today, we're diving into Caput Succedaneum. It's actually really common. Can look a bit alarming, but usually perfectly normal.
That's right.
We've got the essential info here, drawn from revision notes, to help you understand exactly what it is, why it happens, and, what to expect.
Yeah, a quick guide, basically.
Exactly, so you feel confident about this finding.
Okay, so Caput Succedaneum. Put simply, it's swelling and, well, bruising of a newborn scalp. It's caused by pressure during delivery.
Right, the journey through the birth canal.
Precisely.
Ah,
As the baby moves through, their head can get squeezed a bit. This pressure leads to a soft, sometimes puffy area on their head.
okay.
And a key thing to remember, really key, is that the swelling can cross over the suture lines, those natural divisions in the skull.
Okay. That's important, unlike some other things.
Exactly. We'll get to that. It's often seen after longer labors. And the good news is it almost always resolves on its own. Usually no major issues.
Okay, so it's the pressure of birth that causes it. Can we break down how that pressure actually leads to the swelling? What's the mechanism?
Sure. So think of it like this. The pressure during birth, especially if labor is prolonged, it compresses the blood vessels and the lymphatic drainage in the baby's scalp.
Right, squashing everything.
Yeah, pretty much.
Mm-hmm.
This compression causes fluid to accumulate in the subcutaneous tissue that's the layer right under the skin.
Okay.
And that fluid buildup is what we see and feel as the soft swelling. It's usually most noticeable on whatever part of the head came out first, the presenting part.
Makes sense. Are there specific things like risk factors that might make a baby more prone to developing caput succedaneum?
Yes, definitely. A few factors increase the likelihood. Long labors, where the head experiences that sustained pressure, that's a big one. Also, if we need to assist the delivery with instruments, like vacuum extractors or forceps, that can sometimes contribute too.
Instrumental delivery. Okay.
Interestingly, first-time mothers primiparity, they're also more likely to have babies with caput. Maybe because the birth canal is less elastic initially.
Huh. Well,
And if the baby isn't in the usual head-down position,
yeah.
say they're breech or transverse,
Yeah.
that can also play a role because of uneven pressure.
So several things to keep in mind.
Yeah, there's actually a useful mnemonic for revision. Think PLIFN. P for prolonged labor. P for prolonged labor, I for instrumental delivery, F for first pregnancy, and N for non-vertex presentation. PLIFN.
PLIFN. Got it. Okay, so pressure leads to fluid buildup. Now, if a doctor or midwife sees swelling on a newborn's head, what else might be going through their mind? Are there other possibilities?
That's a crucial point, differentiating it.
Yeah.
We need to distinguish caput succedaneum from a few other conditions.
Like that.
Well, one is a cephalohematoma. That's bleeding between a skull bone and its outer covering, the periosteum. And the key difference there is it doesn't cross suture lines. It's limited by the bone plates.
Okay. Doesn't cross, caput does.
Right. Another one, which is more serious but rarer, is a subgaleal hemorrhage. That's bleeding in a different space, under the scalp eponeurosis. And then there's just general scalp edema, maybe from other causes.
So knowing that caput crosses suture lines is really key for diagnosis.
Absolutely. It's a classic distinguishing feature.
How common is caput succedaneum then? Is it something parents should, almost expect?
It's pretty common. While exact UK figures can be a bit hard to pin down, the estimates are generally around 10 to 20% of live births, maybe even a bit higher in some populations.
Wow. Okay, so quite frequent.
Definitely. And it's much more frequent after vaginal deliveries compared to C-sections for obvious reasons related to pressure.
Right.
And it's really important for new parents to know that even though it might look a bit concerning, it's usually just temporary and benign.
Okay. So what will healthcare providers actually see and feel when a baby has caput? What are the clinical features?
The main thing is that soft, puffy swelling on the scalp. It feels, well, fluid-filled, maybe a bit boggy or edematous. If you gently press it, you might feel it shift slightly.
Okay.
And as we said, the big giveaway is that it can extend across those suture lines on the baby's head. It's not confined by the bone edges.
Soft, puffy, crosses sutures.
Got it. And how is it actually diagnosed? Do they need to do any specific tests, like
Yeah.
scans?
No, not usually. The diagnosis is primarily clinical. It's based on a careful physical examination of the newborn, right after birth or shortly after?
Just looking and feeling.
Exactly. Doctors and midwives will look at it, gently feel the swelling. The characteristics we just talked about, the softness, the location, and especially whether it crosses suture lines, are usually enough to make the diagnosis confidently.
So typically no further tests needed.
Typically, no. Very straightforward, usually.
Okay, so it's diagnosed by examination. What's the treatment plan then? What do we do about it? Well, this is the good part. The best treatment for Caput Succedaneum is actually just time.
Ah, okay.
It's what we call a self-limiting condition.
Mhm.
It resolves entirely on its own without any specific medical intervention.
How long does that usually take?
The swelling and any bruising that might be there will typically go down significantly within a few days, maybe up to a couple of weeks at most.
That's not too long.
No. Our role as healthcare professionals is mostly supportive care. That really just means gentle handling of the baby, avoiding extra pressure on the area, and maybe the most important part,
What's that?
reassuring the parents, explaining that this is normal, it's temporary, and it will get better all by itself. Reducing that parental anxiety is key.
That reassurance must be so important. And what's the outlook, the prognosis for these babies in the long run?
Oh, it's excellent. Really, really good. The swelling and bruising virtually always resolve completely without any lasting effects or problems.
Completely.
Completely. Babies recover fully, typically within those first days to weeks after birth. No long-term issues.
That's great news. Are there any potential complications, even minor ones, that parents or clinicians should be aware of?
Well, there's one thing to be mindful of, particularly if the bruising associated with the caput is quite significant or extensive.
Okay.
There could be a slightly increased risk of neonatal jaundice.
Ah, jaundice. Why is that?
It's because the breakdown of those extra red blood cells trapped in the bruised tissue releases bilirubin. If there's a lot of bruising, there's more bilirubin produced, which can potentially overwhelm the newborn's immature liver's ability to process it, leading to jaundice.
I see. So something to monitor.
Exactly. Healthcare providers will usually monitor all newborns for jaundice anyway, but they'll just be perhaps a bit extra vigilant in cases with more extensive bruising from caput, but it's usually manageable.
Okay. So wrapping things up then, the key takeaway seems to be Caput succedaneum is common, looks like a swelling, crosses suture lines, is usually harmless, and resolves on its own.
Precisely. That sums it up perfectly. Understanding common newborn findings like this can really empower you, reduce anxiety, and help you navigate those sometimes overwhelming early days.
Absolutely. And if you want to dive deeper into other pediatric topics or revise for exams, do check out the resources at passthemsra.com and freemsra.com.
Great resources there.
Thanks for joining us for this deep dive.